Good morning, dear students. We are discussing with the growth and development of infant, and we are continuing with the development of infant according to the maturation of the systems. So, how the various systems are getting matured. So, this is actually the continuation of newborn, or how the newborn is there, and after that it is continued. Okay, so first of all you have to understand the what is the condition of newborn, and from newborn how the infant is getting mature. So here I am discussing about the infancy, and you have to read along with the newborn. Okay, so regarding the respiratory system, the first system which we will be discussing is regarding respiratory system. So nearly in a newborn, the respiratory system or respiratory rate will be very fast, and it will be in a newborn period it will be up to 60 breaths per minute, or it will be very fast, and that respiratory rate slows during this infancy. So the very fast breaths per minute which is there in the newborn period will be slowing during the infancy, and respiratory movements will be continued as abdominal, because in newborn also the respiratory movements are abdominal because of the immaturity of the intercostal muscles. The muscles of abdomen will be used for respiration, so the movements of the abdomen will be counted as respiratory rate. So it is continued as abdominal, and chances of frequent respiratory problems can be seen in the respiratory system because of the small airways and narrowed or diameter of the airways are less, or it will be low, and also the length of the respiratory tract is also small. So that's why there will be frequent respiratory problems. One more reason is immunologically the child will be weak. That means there will be deficiency in the immune activities. So that's why there will be chances of frequent respiratory problems in an infant. Next we can see the cardiovascular system. So again in cardiovascular system also we have seen in the vital signs, it will be very fast in newborn period, and it will be nearly 120 to 160 per minute. 160 will be the heart rate. So that heart rate will be slowing down during the infancy period. So comparing to the newborn heart rate, it will be slowing in an infant. Blood pressure changes, like blood pressure will be increasing. Already in vital signs the same thing we have seen, PP increases, heart rate slows, and there will be chances of physiological anemia because of the dilution. Because of the dilution properties there will be physiological anemia. So blood pressure, the systolic pressure rises during the first 2 months as a result of the increasing ability of the left ventricle to pump blood into the systemic circulation, and diastolic pressure decreases during the first 3 months and then gradually raises to values close to those at birth. So systolic pressure initially it will be increasing, but in diastolic pressure initially it is decreasing and it will be increasing later. So this is the change in blood pressure. Next system which we want to see in the development of or maturation in the infancy is digestive system. So digestive system, immature digestive processes will be there. So that will be very clearly seen with the increased frequency of feeding, increased frequency of elimination in urine, and also defecation. The number of defecation, everything will be more comparing to an adult because the digestive system is immature. Next is solid foods are incompletely broken down, especially in first 6 months. The exclusive breastfeeding is recommended because the digestive system is immature. So hard or solid foods are not broken down properly in the digestive system. Stomach size enlarges to accommodate a greater volume of food. So comparing to newborn period up to the 12 months, the stomach size is increasing. So the capacity to accommodate more amount of food will be increasing throughout the infancy. Maturation of sucking, swallowing and eruption of teeth are the another change which is happening in the digestive system. So sucking, swallowing, it will be more easy for an infant comparing to newborn period, and there will be appearance of teeth by 6 months. So these are some of the other changes which can be seen in the digestive system. Next is about the immunological system. So initially in newborn period, the child will be receiving the immunoglobulin, especially maternal immunoglobulin like IgG. Okay, so other immunological factors are very much deficient in infancy. So it may be the IgG may be supporting the newborn to resist against the infections. And production of IgG, IgM, IgA, IgD, IgE happens in infancy. So after newborn period, slowly these immunoglobulins will be produced independently in the child, start production, but it's not up to the level which is required. Next change is the thermoregulation or the skin changes. So during this time it increases the ability of the skin to contract and muscle to shiver. So you have to understand that in newborn there is no muscles to shiver and there is no thermoregulation is very poor. So now the child's skin start to contract and more muscles to shiver during the infancy comparing to newborn, and the skin or the thermoregulation will be able to conserve core body temperature comparing to newborn. Comparing to newborn, the child will be able to keep core body temperature better. And peripheral capillaries constrict in response to cold, but in newborn this response was not proper. So the child will be getting hypothermia attacks easily in newborn. But now during the infancy period, peripheral capillaries will constrict in response to cold, and increased adipose tissue during the first 6 months insulate the body against heat loss. So during this time you can see that infants will be very fluffy, or it will be very naughty, or it will be cute in appearance because of this presence of adipose tissue. Chubby ആയിട്ട് തോന്നുന്നത് ഈ ഒരു അഡിപ്പോസ് ടിഷ്യൂസിൻ്റെ കൊണ്ടാണ്. ഒരു ക്യൂട്ട്നെസ് ഇൻ ഇൻഫൻസി may not be there after infancy, like toddlerhood, preschoolers or a big baby is not that cute as infant. This is because of the adipose tissue accumulation in the infant. So during the first 6 months, so this will be trying to insulate the body against the heat loss. So comparing to the newborn, the infant will be cute in look because of the presence of this adipose tissue, but it protects the skin from any heat loss or any other problems in thermoregulation. Next system which we want to discuss is the endocrine system. So when we are looking at the endocrine system, it has already developed adequately, but functions are immature. So when you are looking at each glands, every glands are present, it is normally developed, but functional maturation is not yet complete during the infancy. So vulnerable to fluid and electrolyte imbalances. So this is the reason why even a small fever or a diarrhea or a dehydration can lead to severe fluid and electrolyte imbalance in an infant. So according to the body proportion and also according to the immaturity of the endocrine system, there is more easily they will be getting the fluid and electrolyte imbalances. Next system which we want to discuss in the development of an infant is renal system. So again, in renal system also immaturity we can notice. So there will be low specific gravity, so that we can say that there is no smell for the urine of an infant, or especially newborn or a small baby. Smell is not there, like foul smell for the urine as an adult is not seen, because the urine or the renal system is immature in function and it has low specific gravity. And frequency of voiding will be more, maybe within half an hour or within one hour they will be voiding. So the frequency of voiding is more, that also indicates the immature function of kidney, and maturity will be occurring during the second year of life. So already in the psychosexual stage and in the psychosocial stage of development we have already discussed that in toddler period, that is 1 to 3 years, the anal stage or the autonomy versus doubt and shame, which is the corresponding stages of psychosocial and psychosexual stages. During that time only the maturation of the renal system or the will be occurring. So that is the anal system and the autonomy versus doubt and shame, which explains. So the same thing is in the renal system. So maturation in the renal system will be starting by second year of life. So hope you all understood. We'll continue the session in the next class. Thank you very much for your kind listening. Thank you.